From packages to patients, how AI is upgrading operations ***, a late package, and a delayed medical test, they seem like completely different problems, don't they? One is a minor inconvenience, the other a source of major anxiety. But what if I told you they share a common, multi-billion-dollar problem? It's called operational inefficiency. It's the hidden friction in our most critical systems, the logistical mess that makes things slow, expensive, and just plain frustrating. And what if the same AI that's learning to get a package to your door faster is also being used to get a patient the care they need with less waiting and uncertainty? We're about to see how the hidden logic of logistics is revolutionizing healthcare, saving not just money, but lives. This is the story of how AI is fixing the fundamental problem of getting things and people where they need to be, right when they need to be there. The high cost of waiting, we've all been there. That special kind of frustration when you're tracking a package only to see its delivery date get pushed back again and again. It's annoying, but for the global economy, it's a massive waste of resources. Little inefficiencies in the supply chain, a truck taking a less than perfect route, a warehouse mismanaging its stock cost businesses billions of dollars every single year. Fuel is wasted, time is lost, and customer trust disappears. It is no surprise that a recent study found that AI could cut logistics costs by up to 13%. This isn't about shaving off a few pennies. It's about re-engineering a system that's groaning under its own complexity. Now, let's take that feeling of frustration and shift it to a hospital. Suddenly, the stakes are infinitely higher. The package is a life-saving medication, a critical diagnostic machine, or a patient. The delivery time is the wait for a diagnosis, the time spent in an emergency room, or the delay before a vital surgery. The median visit time in the U.S. is about 2.5 hours, but for many, it can be much, much longer. And this isn't just about being inconvenienced, it's about outcomes. Delays in care lead to more stress, poorer health results, and an incredible burden on healthcare professionals. It turns out the same logic applies to both widgets in a warehouse and medical supplies in a hospital. A small improvement in predicting demand can lead to a huge drop in inventory costs. The core problem is the same, a failure of operations. An inefficient system costs too much and takes too long, and in a hospital, that cost is measured in human well-being. The solution? Part 1 AI in the warehouse and on the road. So, how do you solve a problem this big? You teach a machine to see the entire playing field. For years, logistics giants have been using artificial intelligence to untangle their operational knots. It starts with something called demand forecasting. Instead of just guessing how many products to stock, AI algorithms analyze huge datasets, historical sales, market trends, even the weather to predict what people will buy with surprising accuracy. Once the product is in the warehouse, AI keeps running the show. At Amazon, hundreds of thousands of AI-powered robots work alongside people, gliding through fulfillment centers to pick, pack, and sort items. Think of it like a perfectly choreographed dance, where everyone knows their exact steps, eliminating wasted movement and maximizing speed. But a lot of the magic happens on the road. This is where AI-powered route optimization comes in. It's not just about AGPS finding the shortest path. These AI systems analyze real-time traffic, weather, delivery schedules, and even a vehicle's capacity to calculate the most efficient route on the fly. It's a dynamic, constantly learning system. Companies using these technologies report significant savings in transportation costs. FedEx, for example, has used AI to optimize its delivery routes, which has led to huge reductions in fuel consumption and carbon emissions. It's a clear sign that by processing millions of data points, AI can make decisions that are simply beyond human capacity, leading to dramatic drops in costs, fuel use, and delivery times. The hidden connection. So AI can predict what we'll buy, find it in a warehouse, and deliver it to our door with breathtaking efficiency. That's impressive. But what in the world does this have to do with a patient waiting for a hospital bed? Everything. A hospital, when you get right down to it, is a logistics system of unbelievable complexity. The packages are patients, doctors, nurses, operating rooms, MRI machines, and vials of medicine. The routes are the journeys patients take from the A2 diagnostics to a hospital room and finally home. The warehouse is the entire hospital itself, with its limited inventory of beds, staff, and equipment. Every delay, every bottleneck, every minute a patient waits for a bed that's technically free but hasn't even logged as clean yet that's an operational failure. It's the same kind of problem that causes a package to get stuck in a sorting facility. So, the solution comes from the same basic idea, using smart, data-driven systems to see the whole picture in real time and optimize the flow of every single part. The logistics revolution provides the exact blueprint for a healthcare revolution. AI in the hospital now. Let's apply that logistics blueprint to the hospital. Instead of forecasting demand for products, hospitals are using AI to predict patient flow. By analyzing admission data, public health trends, and even seasonal events like flu season, these systems can predict surges in visits. This lets administrators adjust staffing and get resources ready ahead of time instead of just reacting to a crisis. Take Johns Hopkins Hospital, which saw patients assigned a bed 30% faster after bringing in an AI-powered command center. Remember those robots in the Amazon warehouse? The healthcare version is workflow automation. AI is starting to take on the massive administrative burden that can eat up hours of a physician's day. Tasks like scheduling, updating billing, and managing patient records are being automated. This frees up doctors and nurses to focus on what they were trained to do, care for patients. One study showed that AI scribes that generate clinical notes could reduce documentation time by up to 70%. And what about route optimization for delivery trucks? In a hospital, that translates to automated patient flow and bed management. When a patient is discharged, AI systems can instantly update a central command center, alerting housekeeping to clean the room and admissions to assign it to the next patient. It closes the communication gaps and manual delays that leave beds empty while people are stuck waiting. The same idea even applies to hospital equipment. Predictive maintenance, which analyzes data from machines to prevent breakdowns, is now being used on critical medical devices, helping to prevent up to 30% of device failures. It's amazing to see how the same core technology can be adapted to solve such different, yet fundamentally similar, problems. If you think this connection between the world of packages and the world of patients is as fascinating as I do, go ahead and subscribe to the channel. We're always exploring the hidden and often surprising ways that technology is reshaping our world, and we'd love for you to come along for the ride. The big picture, the real-world impact, the numbers are impressive cost reductions here, efficiency gains there. But the real impact of this operational upgrade goes way beyond a spreadsheet. In logistics, AI is creating supply chains that are more resilient and responsive. When things go wrong, a storm, a factory shutdown, a global pandemic, AI-powered systems can spot the ripple effects and help managers pivot much faster than ever before. That means fewer empty shelves and a more stable flow of goods for everyone. It makes our connected world a little less fragile. In healthcare, the impact is even more profound. For patients, these efficiencies mean less time stuck in the anxious limbo of a waiting room. It means getting a diagnosis faster, starting treatment sooner, and feeling more in control of their health. For doctors, nurses, and hospital staff, it means a break from burnout. By automating administrative tasks and optimizing schedules, AI gives these dedicated professionals a chance to escape the crushing weight of logistical chaos and put their energy back into patient care. Ultimately, a more efficient hospital is one that delivers better care. It's a place where resources are used to their fullest potential, where decisions are driven by real-time data, and where the focus is squarely on health outcomes. By borrowing the cold, hard logic of logistics, healthcare is actually becoming more humane. We started with two problems that seemed worlds apart: a package and a patient, both stuck waiting. We've seen that in both cases, the real issue was a system struggling with its own complexity, a failure of operations. And it turns out the solution is the same: a new layer of intelligence that can see the whole system at once and optimize every moving part. The AI that routes a delivery truck through city traffic shares a common ancestor with the AI that guides a patient through a hospital. Both are built to find the most efficient path, to eliminate waste, and to reduce the friction of waiting. This is more than just a new tech gadget. It's a deep-seated shift in how our world works. We are building smarter, more responsive systems that can anticipate our needs, whether it's the need for a product we ordered online or the need for urgent medical care. The journey from packages to patients shows us that the hidden wiring of our world is being upgraded. The result will be a future that is not only more efficient and less expensive, but also healthier, safer, and far more responsive to human need.